Hi, my name's Phil. I like talking about politics, and in this video, I like to discuss the brainless populism that is now encouraging the public to blame doctors for the problems with our national healthcare in a way that is actually just going to make things worse for an already certain to be devastating winter. But first, if you'd like to be notified of daily news in politics, please subscribe to the channel and click the bell notification icon. So last week, the Daily Mail ran a front page proclaiming victory. What this time? It was over a campaign to get the government to force doctors to see more patients face to face. The government have announced league tables for this. The headlines even go so far as to say hit squads. Their words, hit squads for those that fail. That's where we are now. Hit squads against our community doctors. Now, I've been a teacher, and so league tables are a huge bone of contention for me, as they will be for many people in various professions. The general idea is sound. See, you use them to encourage a focus on particular outcomes that are part of a national coordinated strategy, and it can work. Labour used them very well, for example, in healthcare to reduce waiting times in A&E. Sort of worked. They've gone back now, by the way, because the Conservatives kept missing them, and so they kept watering down the standards and then just got rid of them altogether. But the point is that league tables can be used effectively. But there is always the problem that, like with any statistic, it can be gamed in a way that is not really in the spirit of the intention. And you can end up doing more harm than good. So you have to be very, very, very careful about the way you structure the league table. Also, as with any statistic, members of the public for whom these league tables are intended don't actually know what the data means, they just think they do. Again, misinterpreting data leads to spurious conclusions, meaning that the league table can, if not carefully managed, do more harm than good. Finally, you've got the biggest pitfall at all, that you put emphasis on an outcome that is not only not important, but actively harmful. This is the case with having a league table for face-to-face meetings. GPs are at pains to explain that they get a lot of patients coming to them with issues they can do nothing about. Okay, sometimes it might be an issue that the patient would have reasonably expected that might be able to. You just have to see in case. But, there'll be things like, it could be a dental issue. Well, for that, they have to go to a dentist. But this happens a lot because you can't actually get a dentist in many places these days. You've got no chance around here. More chronic underfunding has left dental care in a way worse state than many other forms of healthcare. So, of course, if people got a problem out of desperation, they'll try their GP. It might be that dental care is not as badly off as mental health care in this country, which is basically non-existent. But they also get patients coming to them with completely non-medical issues. Doctors are clever. People have ready access to them. A lot of folks just don't know where to turn with some of life's problems, so they turn to their friendly GP. Now, if we had a generous capacity within general practice, you could manage this. But this is not the case. Even before the pandemic, you had to get through a receptionist before you get to a doctor. They would sort out what are the issues, what's your issue here, and filter out any that the GP clearly wouldn't be able to help with. Sorry, we're a doctor's surgery. Can you go away? But that still leaves people with an illness that can only get self-treatment. There was an amusing, though very sweary rant from a GP, which I'll hopefully remember to link below, talking about people having blocked noses, for example. Classic case of something that doesn't need a physical meeting with a doctor. It doesn't actually even need a telephone conversation, quite frankly. But a telephone appointment is fine for any consultation that doesn't need a physical examination. You don't need a physical examination for a blocked nose. What you need is a hot drink and maybe some Vicks. But the brainless hacks at the Daily Mail, in agreement with the equally vapid Health Secretary, think that this should demand a face-to-face meeting. After all, such a league table works inflexibly on the assumption that face-to-face meetings are preferable. The problem is they take longer. If they take longer, you can see fewer patients. So what the government have done here is to create a league table that actively encourages doctors to see fewer patients. But it doesn't end there. In order to maximise your position in that league table, you also need to have as many face-to-face meetings as possible. That means making them as short as possible. Get them in, get them out. So the league table also encourages doctors to not really listen to the patient. I ain't got time for your jabbering. They just make a snap judgment about what might be wrong with them and decide whether to prescribe painkillers or antibiotics. Maybe even consulting a magic 8-ball to save precious seconds of clinical judgment and then send them on their way so you can get in the next case. That is the practical upshot of applying such a league table. And the Health Secretary knows this. He's just pandering to the press with this nonsense. He's not actually that stupid. When asked a question about what should happen at the weekend if someone has something stupid like a blocked nose for a day, he even said, telephone the doctor and the doctor should decide. But that's not what his male pandering policy says. His policy says that the patient should meet face to face with the doctor. None of this telephone malarkey. The more telephone consultations the doctor has, the lower down his league table they go. This is not unlike their policy on face masks. Well, yeah, of course people should wear face masks when in contact with people they don't live with in indoor settings. Oh, so you're going to tell people they have to? No, we're just going to suggest it. Oh, so you're going to lead by example and all you lot are going to wear face masks when jammed into the House of Commons like cattle? No, we're not going to take the lead on this one. Now, you may imagine that doctors will just ignore this rubbish and carry on as they have been doing, trying to manage their caseload in the most efficient way possible. You know, with severe shortages of GPs and in the middle of the worst healthcare crisis in a century, they have to do what they can. You know, and made arguably worst in history by our bumbling government. But there are problems with this. See, the government intend to punish doctors who don't meet some sort of arbitrary threshold of position, because this isn't a suggestion. This isn't like, we'd like you to have more face-to-face meetings. All right, then we'd like to see as many patients as possible, so we're just going to carry on with telephone. No. It's like, we insist you have more face-to-face meetings. We are putting in a league table to encourage this. And there's going to be punishments if you don't. You know, it's also working in encouraging members of the public to abuse their doctors. Because now, like if they're offered a telephone appointment, you know, they've been reading these things instead of a physical one, they're thinking that they're being cheated. Well, this is creating a terrible working condition for the doctor when they are already stretched beyond reason. The public should be angry at the government for continually failing to meet their target to recruit GPs, not at the GPs who are frequently working over 12-hour days in a vain attempt to meet overwhelming demand. A former Conservative Health Secretary, Jeremy Hunt, recently talked about his own failure to recruit 5,000 new GPs. He said the problem wasn't that you couldn't get more into the surgery. He says, but they couldn't get enough to match the much less exceed the rate of retirement or going part-time. Hunt said that the profession was burnt out because of the massive mismatch between supply and demand. So you had GPs retiring early because they just couldn't take it anymore. I mean, you imagine especially an elderly GP trying to do 12-hour days under all this pressure and now under all this abuse. Of course they're going to retire. And then if you're not in retirement age, at least drop down to part-time. Give yourself some breathing space. Of course they're going to do that. And the more pressure you put on them, the more they're going to do that. Now, if we assume that the government are trying their best to boost supply, and that requires a mighty charitable assumption, then they still need to focus on demand. You need to try and reduce demand. This moronic policy actively increases demand. Doctors have been managing demand by carrying out more efficient telephone appointments for whatever doesn't need a physical examination. And when you have that telephone appointment, and if after the consultation they think a physical examination is needed, then that appointment is made. It allows them to effectively deal with more patients and therefore meet more demand. This league table crap means the reverse. They have to see fewer patients, ramping up demand. And this not only means that many more patients simply don't get seen at all, or as I said before, they don't get a proper consultation, and the time pressure means doctors have to get them out their rooms quickly. But it also means that the doctors themselves become more stressed as they will be acutely aware that they are not managing to meet demand. More burnout, more retirements, or dropping down to part-time. More of a mismatch between supply and demand. Instead of which, we shouldn't have pandered to the Daily Mail. We should have had a health secretary who would point out that their cretinous idea would lead to fewer people being seen. How would you feel, he should have said in the interview, how would you feel, Joe Public, if you were unable to get an appointment to see your doctor for a lump because a dozen dickheads with blocked noses had made their appointments before you? Turn it around. That's what someone lobbying for the health service should do. And lobbying for the health service is what a health secretary is supposed to do. But we don't have a health secretary. We have a greedy banker who wants the NHS to collapse so that they have a ready excuse for replacing it with an unregulated, privately funded model where, just like in America, we can once again see the sights of a woman begging for people not to call an ambulance as they lay there bleeding because they can't afford it. And this would be outrageous at any time. But this winter is going to be a hammer blow to our NHS, the likes of which we may not have seen, and we've seen some. You know, again, because this so-called health secretary has stripped away all our mitigations, and now we are looking at a winter of both COVID and flu carnage, to say nothing of the ever-extending waiting list for treatment, because we have a government who have a mission to destroy our NHS. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.